Now let's look at your ability to curl your tongue. You might also hear this test called a lateral tongue curl or a hot dog bun tongue. The reason this is important is it gives us more information about your tongue coordination, as well as your tongue range of motion and potentially your tongue strength. We've talked a lot about suctioning your tongue slightly to the roof of your mouth as normal tongue resting posture. Okay. If you are unable to elevate the sides of your tongue with a generally caved out center of your tongue, it will be harder to obtain ideal resting posture of your tongue, and it will also make it more difficult to initiate a swallow, or at least phases 1 and 2 of a normal swallow. This test is very basic, and I'm sure you've all done this to some degree. If you're doing this on yourself or your child, make sure you're doing it in front of a mirror. So what you're going to do is just generally relax your lips as much as possible and curl your tongue. So it will look like this. For this test, you want to see how much lip use you're using. If you're having a very difficult time generally relaxing your lips, do note that in the comment sections of your assessment form with this one. And also take note on any other compensations that you're noticing, whether it's your neck is really, really tight and trying to create this, or potentially you can't even curl your tongue to that degree. If you don't have an assessment form yet, remember you can click the link below, enter your email address, and a full myofunctional therapy assessment form will be emailed to you so that you can follow along as you perform these tests on yourself or your child. If you have any questions with this test or any of the others that we've gone through, don't hesitate to write your question in the comments section below. Find me at summerspt.com or reach out to your local myofunctional therapist.